Hey, it's Dr. Schmidt. So it's present day. I recorded this video yesterday in the afternoon, and then in the evening I gave a lecture to about a dozen people who had never seen me before, and I gave this information. And there was one guy, he challenged me within the first 5 or 10 minutes, and he was really pissed off. He spent a lot of time on his phone as I'm talking, and he took the opportunity to escape as soon as he possibly could. And he was so irate. Well, it turns out that that guy is a nurse, and he's telling people to follow various dietary guidelines that he has to say. He has to obey what his license tells him to say. I'm sure he's feeding people bread and cereal and low-fat milk and low-fat cheese in the hospital. So when you look at this, when you watch this video about how to win a debate in nutrition, you got to really consider that there are people who they cannot take your answers because it is who they are. A nurse, a dietitian, an MD, a nutritionist. And if they sway from what the government tells them to do, they can get fired. Or there are people who it's their being, it's who they are that they don't eat meat. Or it's who they are that they only eat meat. So you're dealing with personalities. Nutrition it's like religion, for a lot of people. And they don't have the flexibility that we all should have in order to adapt to our body's changing needs as years go on. So anyways, just check out this video, and I just want to give you a little primer. This information can really piss some people off. And one more thing I want to say is that when you look at some of the leaders in the nutrition field, we're talking the academics like Walter Willett at Harvard School of Public Health, and other there's social media personalities and stuff. They don't know how to read the research, but yet they claim they do, and they cause 500,000 people to die every year from heart disease, 500,000 from cancer. Year after year, tens of millions of people have died from poor research interpretation. And you could say these people deserve to be in jail because they don't change their mind. They don't learn how to read the research correctly or evaluate the quality of that study. They can look at the study and talk about what the study says, but they haven't evaluated the quality of the study and whether or not it should go in the garbage or whether or not it's worth talking about. So yeah, I think some people should be in jail because they're not giving the good advice that they should be giving. They're giving the opposite, deadly device that's killing people with diabetes, heart disease, and cancer. So there's my 2 cents.
Hey, it's Dr. Schmidt. So I want to teach you how you can win a nutrition debate. And it's not about bringing up your favorite articles versus somebody else's favorite articles. It's about knowing what the different types of research are. So I'm just saying this off the cuff, and you can watch this video multiple times. You can take notes. You can practice and repeat what I'm saying. So this is not well known. It's so not well known that even medical journals like Lancet, JAMA, British Medical Journal, they don't know this. Of course, governments don't know this. Medical doctors, nutritionists, dietitians around the world don't know what I'm going to say right now. So, and maybe, somebody in your family, a teacher, maybe your 8th grade child is being taught the wrong stuff. This is how you counter it by talking about what kinds of research gives us what kind of information. All right, now here we go. There's 2 types of research. One is an observational study. Now there's different words for it too, cohort, epidemiological, but I'm just going to use the word observational study because you're observing. You're not doing anything but looking. The other type of study is a trial, an experiment, where we actually do something. Okay, and that makes all the difference in the world. So we have 110 years of observational studies, and that's why the military, the schools, the dietitians, etc., give us the wrong information because the observational studies give us wrong information, and here's why. because there's two types of people. And in this one group of people, they're called non-adherers. They smoke, they drink alcohol, they don't wear their seatbelt, they're overweight, they don't exercise, they don't go see their doctors, they eat junk food and they eat meat. The other group of people tend to adhere to the healthy practices that are taught to them. They don't smoke, they don't drink, they wear their seatbelt, they're normal weight typically, they exercise, they go see their doctor, they do everything their doctor tells them to do, they don't eat junk food, they eat less or they eat no meat because they're told meat is bad, and then they eat beans. Okay, so between these two groups of people, can you say that meat is bad? No, because there's too many other factors. Now, in observational studies, they'll try to control for these other factors. They'll try to take out the smoking and the drinking and the exercise or lack of exercise. They try to take that out, but it's not good enough because there's other factors in here, like, for example, emotions. So maybe these people here tend to be more angry, and these people here tend to cry more, or they're more happy, and they're more conservative, if you will, with their emotions. So can you take that out mathematically? I haven't seen that. Maybe you can. But the point here is that there's so many factors that you can't say that meat is bad based on an observational study. What you do is you make a hypothesis, you make a guess. And you say, okay, looking at all this and looking at all this, I'm making a guess that meat is bad. Then you send that to a trial where you actually do an experiment. And you take two groups of people, random people, and you tell one group to reduce their meat intake by 20%. And you follow them for years. And this has been done. And what you see is that there's not a decrease of cancer, heart disease, or diabetes in the group that reduced their meat intake. And that study is called the Women's Health Initiative. It only takes one study to negate 110 years of observational studies. 90% of nutrition science is just an observation. And so this information comes from Dr. John Ioannidis. I've talked about him before in other videos, but he's trying to change the way research is done and make it worthwhile and to make it valuable, because we're spending billions of dollars on junk science and we're getting bad results. And it's not just bad, it's the opposite of the truth. So now if you were to look at let's say your opponent in the debate gives you a study and it says, look, meat causes disease. You look at that study and you have to see, is it an observational study? Chances are it is. And then you look at two things. Number one, is there a food frequency questionnaire? If there is, you can throw it out because that's been proven to not be valid. And number two, you look at the math. And there's three terms. One is called the relative risk. Another one is called hazard ratio. The other one is called odds ratio. RR, HR, OR. Those three things leave you with a number, and that number is, it could be 1.1, 1.5. It's got to be 2.0 or greater in order to pay attention to it. So if it's 2.0 or 3.0, then you send that to a clinical trial. You can't make a clinical recommendation or lifestyle recommendation based on an observational study. And certainly if the relative risk, or 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 HR, is less than 2.0. But you take that hypothesis and you do a trial on it. Then, if you're ethical, then you make a clinical recommendation based on the trial, not based on junk observational studies. So now there's a guy named Kip Anderson. He's done some vegan documentaries. One is called Cowspiracy. And he says that smoking a cigarette is equal to eating bacon, because there's one observational study that says that the relative risk of, I think it was heart disease or something, from eating bacon was 10.0. I've seen the study. It does exist. Okay, but again, you can't get causation from it. You take that study and you do a trial. Now you can do an ethical trial with meat and with bacon by telling people, telling one group, eat less meat, eat less bacon, and you look to see if the rate of disease goes down. And it's not been shown, meat has not been shown in a trial to cause disease. And if I'm wrong on that, please show me the study below. Put that study below, and I'll read through it and I'll correct myself. But trial after trial shows that meat is not a factor when regarding disease. And so having said that, I'd like to say nobody's ever died from eating meat. In the history of humanity, nobody has ever died from eating meat. So there you go. So you break that nutrition observational study into these two groups, and this is how you can say that beans are not necessarily healthy. You can't prove that beans are healthy with an observational study. And you can't prove that meat is bad in an observational study because of all these factors. So if you like this information, please give me a thumbs up, share, subscribe, hit the bell for notifications. If you want to be a patient, it's best to call the office. You can also email. All the information is below. All right,